Thanks, Anthony. So starting May 26th, there's some new enforcement guidance by OSHA on whether COVID-19 employee illnesses may be reportable. This new guidance supersedes just the recent guidance that came down in April that basically said that most non-healthcare businesses were not required to report a COVID-19 illness, except if there was some objective evidence indicating it was workplace related. Now, pretty much all employers, with very few exceptions, must take active investigation and actions to determine if a COVID-19 illness is reportable. And it will be if the case is a confirmed case of the virus as defined by the CDC, or if the case is work-related, meaning an event or exposure at work that caused or contributed to the COVID-19 case, or if the case involves one of the other general recording criteria under the OSHA standards. Anthony, we could move to that next slide. So the main issue here is going to be, is the COVID-19 employee illness work-related? Now, the OSHA has acknowledged, and they continue to do so, that it is going to be very difficult to determine if a specific infection is work-related, especially when people are exposed to the virus both inside the workplace and outside the workplace. But under this new guidance, when OSHA inspectors come out or they get complaints, they're going to be looking at three main categories of items to determine if you, the employer, has made a reasonable workplace work-related investigation. And the first item will be they'll look at the reasonableness of your investigation into the workplace relatedness. Now, you're not required, and especially small employers, to conduct any extensive medical inquiry into this. In most circumstances, OSHA says that the things that you should be doing is asking the employee how they believe that they got the infection. Discuss with the employee the types of activities inside and outside the workplace that may have been the cause of the exposure to the virus. And then also to look at your environment. Are other employees infected? Are there multiple employees? Are those employees in close proximity to the one that you're looking into? And also the OSHA is going to be looking at your precautions that you have in place. Do you have good hand hygiene? Are you requiring temperature checks? Do you require the workers to have face coverings? And then the next item that the investigators will be looking at is what evidence that you have that there is of the that the case was contracted at work, and it's only what evidence is reasonably available to the employee. And the last category is OSHA has acknowledged that there is no definite formula to make this determination. Is it work related or not? And they give examples of what is likely work related and is not work related. So to stay compliant, conduct a reasonable objective work-relatedness determination, document that process as always, maintain your healthy workplace standards in compliance with state, local, and public agency guidelines. Always be mindful of your privacy rights of the employees and their medical information, and also just be wary of taking any adverse action against any employee that may make a workplace complaint. Even if that complaint is unfounded, it could form the basis of a retaliation claim, and you certainly don't want to have that a litigation in the midst of this, all these other things that are happening in the workplace. And if there's any complications or any uncertainty about how you apply these new standards, you should contact your legal counsel.